the nutritional assessment. So first we'll take the anthropometric measurement of the patient. So first we'll take the height of the patient. So bago dito sir, kaya ako take yung height sir. Okay, so the patient's height is 163 centimeters. So now we'll take the patient's weight. So bago dito sa weighing scale sir. Okay sir. So the patient's weight is 40 kilograms. So we'll now compute for the BMI. Patient's BMI is 15.1, which indicates he is underweight. And his desirable body weight for his height of 163 centimeters is within 53 kilograms to 66 kilograms. But his usual body weight within this year has always been 40 kilograms. But I think there has been developmental consideration since he is still 12 years old. So now we'll do the triceps skin fold measurement. In this, we'll find the midway between the shoulders and the elbows. And upon finding the midway, we will now pinch it and allow the muscles to go down. And when the subcutaneous fat is the only one left, we'll measure it. So first, we'll find the midpoint between the shoulders and the elbows. So relax ito sir. So it's 30 cm, so the midpoint is 15. This is the midpoint. So now, we'll pinch it to let the muscles relax. And in doing this, we need to use the non-dominant hand, which is the left hand for the client. So upon pinching it, we'll now use the caliper. Okay. So the measurement is 2 cm. So aside from this, we'll also measure for the mid-arm muscle circumference. Same as a while ago, we'll find the midpoint between the shoulders and the elbow, and we'll measure the circumference. So we'll find again for the midpoint, 30 cm, so the midpoint is 15. And we'll get the circumference for this area. Isa pa gawin sir. So the muscle measurement is 12 cm. For the anthropometric measurement, we'll do the waist to hip ratio. So in this part, we'll ask the patient to raise their t-shirt and we'll measure the waist and hips, and we'll ask for the ratio. We'll do this by dividing the waist measurement to the hips measurement, and for the male, a 0.99 or lower ratio is a good measurement. So at least sa itong t-shirt sir ha, naka-measure mo yung kuan ng waist. Okay, so the patient's waist is 61 cm. So now we'll measure for the hips. Okay, so the patient's hips is 66 centimeters. So the ratio for a 61 centimeter waist and 66 centimeter hips is estimated as 0.92, which is good for a male. So review for the laboratory test. Since there is no given laboratory test, we'll just take an example. So in a laboratory test, there are countless variables that are included in there. Example of which are serum albumin. Decrease in serum albumin can indicate a malnutrition for the patient. Also, another one is hemoglobin. Decrease in hemoglobin count in the laboratory test can indicate iron deficiency anemia. Another one is a 24-hour urine creatinine. An increase in creatinine in the urine content can indicate an increase in tissue breakdown. Another one is calcium levels. If there is a decrease in calcium levels, it could indicate a problem in the parathyroid gland, and this can be manifested through cramps. Another one is potassium. A decreased amount of potassium can indicate that a patient has experienced vomiting, diarrhea, and adrenal gland disorders in the past few weeks or months. And this can be manifested through weakness, cramps, and twitching sensation in the muscles. So we'll now proceed to the clinical evaluation of the patient. So first, we'll assess the general appearance. So upon inspection a while ago, the patient was fluent in speech and can deliver the idea precisely. And upon inspection right now, the patient is has a well-combed hair and has dressed appropriately for the weather. And also, we also do evaluation of the orientation. And I can assess that the patient is alert, meaning that he can respond to the question appropriately and has no trouble in thinking or of a response to the stimuli. Now we'll inspect for the skin. In this part, we'll note for surface characteristic, hydration, and lesion. So first, I'll observe for surface characteristic. Okay, so pwede mo yan yung comment, sir. Yeah. Okay. I'll observe for the skin, the legs. So for surface characteristic, the skin color remains the same all throughout the body. There is no hyperpigmentation or hypopigmentation. And when it comes to hydration, the skin of the patient is well hydrated. And for lesions, I have not observed any lesions from the patient's skin from head to toe. So there is no problem with the patient's skin. So for the patient's hair, in this part, I will note for the hair's appearance and texture. Okay, sir, okay na sir na ako i-feed yung buhok, sir? Okay, so the patient's hair appears to be curly, it's not straight, and it appears shiny, meaning it's well moisturized. And this can be supported through its texture. The texture of the patient's hair is smooth and silky, meaning it is well hydrated and well combed, meaning it is well hydrated at all times. So for the patient's nails, I'll observe it for its appearance and its texture. So, sir, pwede na ba tayo magkuko, sir? Okay, so the patient's nail is well trimmed and it's light pink in color, and for its texture, it feels smooth. And there's also visible longitudinal lines on the nails, but it's not really that apparent, which can indicate dryness. And I'll also check for capillary refill to check for peripheral problems in the vascular system. Okay, upon performing for capillary refill, the blood was able to go back to its area within less than 2 seconds. So now we'll inspect for the eyes for its surface characteristic. In this part, we'll note for any lesions, foreign bodies present in the eyes. So, sir, pwede ka malingin ako, sir? Okay, upon observation of the eyes, there is no pterygium. There is also no discharge nor lesions in the eyes, and the eyes appears well hydrated. There is also no foreign bodies found in sclera and in the pupil. And there's also no protrusion or sunkenness in the eye socket. So the patient's eye has no problems at all. So now we'll observe for the oral cavity. So first we'll observe for the dentation. In this part, we'll observe for any oral caries and any problems with his tooth or with his teeth. So pwede ka mga nga, sir. Okay. Smile, sir. Okay. So the patient has no dental caries, and the patient also has no missing tooth. But with this case, he is wearing new braces to fix the alignment of his teeth. So now we'll focus on the mucous membrane. So in this part, we'll look for any lesions or discharges in his mucous membrane. So pwede ka mas mabag, sir. Likod ang gums. Okay. Yan nga, balik. Okay, so the patient's mucous membrane has also no lesions, nor discharge produced. So now we'll observe for the patient's extremity. So first, we'll start with the muscle shape. So upon inspection of his muscles, there is no atrophy or muscle atrophy or muscle hypertrophy. So let's talk about the patient's muscle size. So the patient, based on inspection, doesn't have a muscle size of a bodybuilder, but rather he has a lean muscle size, which is appropriate for his age of 12, and for his level of activity, which is sedentary. And now I'll check for the muscle tone. So pwede naman yan ang comment, sir. Paano siya, ipa-relax na nga, lang. Okay, so the wrist, the muscle tone for the wrist is normal. There is no specific spasticity or rigidity. So now I'll proceed to the elbows. Relax on, sir. Okay. Ika, sir. Okay. So there's also no spasticity and rigidity of the elbows. So now I'll proceed to the sensation. So in this part, I'll ask the patient to close his eyes, and through this spin, through a dull part and the sharp part, I'll ask the patient if the one I'm pushing against his finger is a sharp one or dull one. So dili sir kay atubos ng eyes niya i-prick ka ni sir kaning nay dull na side na sharp na side. Ingon ka sir if mo na feel ka na dull or sharp ha. Sige sir. Una ko si mong kan sa right hand sir. Sige sir. Close ng eyes sir ha.
Sharp,
Okay.
sharp, sharp, dull, dull,
Okay. Ika sir.
dull, dull, sharp, sharp, dull.
Okay, so the patient's upper extremities is able to sense the sharpness and the dullness. We'll check for the muscle tone in the lower extremities. So first we'll start with the knees. So relax the sir ha. Okay, we're also checking for the hips. So the left for the left knees and hips, it has a normal muscle tone. There is no spasticity and rigidity of it. So now we'll check for the right knees and hips. Relax at the sir. Okay, so the muscle tone is also normal. There is no spasticity and rigidity. So now we'll check for the ankles. Relax at the sir. Okay. So the muscle tone for the ankles is also normal. There is no spasticity and rigidity. We'll also check for the sensation for the lower extremities. So in this part, we'll also ask the patient to close his eyes. Then using this spin with a dull and a sharp side, we'll prick the toes. So we'll ask the patient whether he feels a sharp one or a dull one. So sir, sige pa sir ha, at close ng eyes. Nya, i-press ko ni ang ganing pin ni dull o sharp. Nya, mo i-guess if dull or sharp sir ha. Sige sir. So na.
Dull, dull, sharp, 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 dull, dull, sharp, sharp.
Okay, sir, in the lower extremities, the patient was able to distinguish between the dull one and the sharp one. So the sensation is also intact.